want to bring in Major Garrett and Anita Kumar. Major is CBS News Chief Washington Correspondent, and Anita is a White House correspondent and Associate Editor for Politico. Oh, it is so wonderful to see both of you and to get the chance to talk to you again. Major, I want to start with you. There's an Axios report that says that some of the president's aides are pushing for a May 1st deadline to reopen the government. What does that tell us right now about the kinds of back and forth that is happening in the West Wing in the midst of this global pandemic?
That the president wants to reopen the country. He said it in his own words, and the guidelines from the president, backed up by his medical team and the Centers for Disease Control and Prevention, last until April 30th. And there are some advisors who say, Mr. President, you say out loud, we hear you frequently at the briefings, America's got to get reopened. How about May 1st? But as the president said yesterday when asked by Ben Tracy, our colleague, and others, he said, I'm going to rely on the data and I'm going to rely on the scientists and the medical advisors. So the president, in his own words, is giving the country an impression that that's what's going to drive this, not his economic team, that this is going to be a science and medical advice-driven process, not an economic or even political one. But we have guidelines from the federal government, from the president, that last until April 30th. But the pressure beneath that certainly is for an economic reopening sooner rather than later. Again, I'm quoting the president directly there. But in his own words, as much as he wants to be an advocate for a reopened economy, he's also said, and the country, I think, will hold him to this, that whenever the lifting occurs, whether it's by geography, by a very specific area and a very specific time sequence, not shared by the rest of the country or all parts of the country, it will be data and science driven. The country, I think, will hold him to that.
And Major, just remind our audience, I mean, the message consistently has been from the public health experts like Dr. Anthony Fauci, like Dr. Deborah Birx, members of the task force, is that it's the virus itself that sets the timetable here, nothing else.
Yep. Nothing else, although one thing they often say is the virus does set the timetable, but the virus can't set that timetable if we are distanced apart. Dr. Fauci said a couple of times, and Deborah Birx has as well, if you're outside that 6 feet area, the virus can't chase you. It can't do things unless we're too close and we're not adhering to social distancing and staying at home and out of places where social distancing is either very difficult or impossible. So we do have one behavioral remedy or one behavioral response, and that is social distancing, wearing a face covering in public now, CDC recommendations. So those are things we can do. And the data suggests because we are doing that, some of the curves are flattening and some of the incidence rates of intensive care, death, and hospitalizations are declining in some of the cities that were the hottest of all hotspots. All that is encouraging news. But I've talked to many people, not only in the disaster preparedness and response world, but in the medical world, who have this great anxiety that if we lift those restrictions too soon, we could create another wave of this. And so that's the very difficult and challenging balance to strike. What does the science and what do the medical professionals say about not only what the data reveal, but how that should inform key public policy decisions for the economy and moving us back to work?
Before we let you go, Major, because I know you have to get going and do another hit here, I just want to get your analysis and perspective on these White House coronavirus task force briefings. By the way, this is a perfect opportunity for you to plug your latest podcast, Debriefing the Briefing, which I have listened to. But the idea here is that these briefings have evolved. You know, this is a task force that was first formed on January 29th. The Vice President, Mike Pence, was named chair on February 26th. The first briefing, we believe, was around January 31st. And now you have these briefings stretching well into 2+ hour territory on a pretty regular basis. So I know on your podcast you do what we try to do here, which is unspool and sort of distill as best we can the most salient points out of the briefings. Can you just talk about the evolution of what we've seen with these briefings?
Well, the briefings have taken on a life of their own and have become dominant events for the President of the United States, to the consternation of some. But look, we're in the middle of a global pandemic and an American crisis, the likes of which we have not seen in our lifetimes. We have never seen stay at home and stay in place orders like this. We've not seen the cessation of work. We have not seen the cessation of entertainment and all sorts of other day-to-day common aspects of our lives, all to deal with this particular virus and this pandemic. So when the president talks about that, that's a straight up news event, full stop. What we try to do with the podcast, and we also make it available to radio stations in a 6-minute format, many are taking it, is distill, synthesize, and summarize the key points, weed out the talking points from the president or conversations that have nothing to do with the latest medical or data or government response to coronavirus, and just stick to those things. And we found an audience for that because people, even though they're at home, don't have the bandwidth or the attention span or the endurance really to sit there for an hour and 45 minutes, as you said, Elaine, sometimes 2 hours and 15 minutes to wade through all this. We try to do that for you. We are not wagging any fingers. We are not like fact checking. We're not saying, oh, we watch so you don't have to. We want everyone to watch. But if you're also looking for a distillation, a fact-based summary, that's what we try to provide. And we found an audience for it. So I'm happy about that.
All right, Major Garrett, it is wonderful to see you coming to us from your home office there. We really appreciate your time, Major. So great to see you. Take care. We'll talk to you soon.
Great. Thanks.
All right, Anita, let's continue the conversation here. It's wonderful to see you as well, by the way. We're all working from home. We should point out everyone has been watching. Yes, it's been such a long time, Anita. But I want to ask you about this story that the White House is pushing back against, a story that said that there was a November intelligence report warning about the impact of the coronavirus. What more can you tell us about that?
Well, they did push back. It was the Pentagon, actually a defense official. And what was really unusual about it, it was an on-the-record statement from the Defense Department. And they don't usually go on the record or talk or push back so much when it's about an intelligence matter. So it was really striking that they did do that. But let's put it into context here. What's going on is that we have heard and learned that the president was first briefed about the coronavirus in January. So this report from ABC News is saying that that the president knew about this or should have known about this maybe back in November. That's a huge, it's huge time difference. The president has pushed back and said he got to work immediately when he heard about this, working on travel restrictions and getting things into place, and he took it seriously. Now, some of his rhetoric doesn't appear that he did, but if they are saying that he knew really 5 or 6, 7 weeks earlier, that would really change the narrative, and there would be a lot more criticism on the White House and the administration.
Anita, I also want to ask you about reports that federal funding for state-run drive-through testing sites is set to expire on Friday. Does that line up with what we've heard from the administration about being a backstop, essentially, for states?
Right. The White House and the president has continued to say that the state should have had both the funding and the supplies ready for something like this if it were to happen. Now, if you talk to experts, they say nothing like this has really happened, at least not in 100 years or so. And so no one was really prepared. The states weren't, and the federal government wasn't either. These drive-through tests and these, test centers that you could have were supposed to crop up all over the country. That's what the president talked about, 5, 6 weeks ago, and that hasn't really happened. And so some of these centers are really crucial for people to get these tests, especially as the new test is coming out, where you can learn the results very quickly as opposed to waiting days. And so, states will have to decide if they don't have that money, whether it's more important to spend the money on that or something else like supplies.
And Anita, finally, you have some new reporting, I understand, on how some hotels across the country are stepping up to house patients or first responders. What can you tell us about that?
Sure. That's really particularly happening in New York City, where obviously that's the epicenter right now. What we heard was at least 20 hotels. So that's not too many, but 20 hotels or more are going to become hospitals or host first responders who can't make it back to their homes. What we're being told, though, is that the Trump Hotel in New York, as well as some other cities, is actually still open, accepting new reservations in New York City, as well as Washington, D.C. and and Chicago. The president's 4 other hotels are closed, but none of the 7 have volunteered with local officials to be shelters or to be makeshift hospitals. And so at the moment, they haven't answered the president's own call, which he's asked companies to come forward and help with the coronavirus, and his own businesses have not done that.
Really interesting reporting. All right, Anita Kumar. Anita, again, so wonderful to see you.
Sure.
Thank you so much for joining us.
Thank you.